What's going on, everybody? Welcome to another episode here on the Digital Classroom Dental Podcast, where I'm spending time with the amazing educators in our industry and having them share events and courses and things they're doing. And I'm very, very excited to be here in Las Vegas at the first annual Dental and Medical Insurance Extravaganza. Yeah. Christine Taxon has put together a great event. We've got a lot of great companies. We've got great speakers on topics that are really relevant to the industry. And very, very honored with my guest who's sitting right next to me, JanetPress, who has been doing a lot in dentistry for many years. So it's very nice to have you.
Hi, John. Thank you for the invitation to sit down with you today and talk about it. And I'm really happy to be at this great event that Christine's put together. We need more of these types of events where we're all collaborating on the same level and making all the changes that we need to make in our practices. So congratulations, Christine, for having the vision to bring us all together.
Absolutely. Well, especially in Vegas, a great place. You're very familiar with this place. You've been here your whole life.
Yeah, it's my hometown. Nobody believes that you can actually live here. We don't live in the hotels. We actually have homes that we live in.
That's awesome. Well, I know tomorrow you're going to teach a course, Perio 2018. There is more to gingivitis than we ever thought, and I know you were talking about that on a recent break, even before we started to record, and would love to have you share that. Before we do that, you have done so much in dentistry, and you have been known certainly as a pioneer in regards to lasers and things like that. So would love to have you share a little bit about your background and your passion and how you got to where you are.
Okay, well, thanks. I really appreciate that. I have been in dentistry a long time, and I take a lot of pride in that. When I tell people that I've been practicing for over 40 years, their eyeballs get really wide, and I say, you know what? I've stuck around for the good stuff, and I really feel that way. The changes that are taking place in periodontics and in every moment of our life in the dental practice is phenomenal, but it's about time. So we all have to get our resources together and spend the time in continuing education that's going to bring us to the place where we can take better care of our patients. I do teach laser dentistry. I teach laser hygiene. I teach the implementation of it, and my courses are all workshops. They meet the curriculum guidelines for laser dental education, the standards of that in the United States, and I am a course provider throughout every state, and there are some states that have very strict and rigid requirements for using lasers as a dentist and a hygienist, and I'm qualified to teach in all of those states. I've met all those requirements, and I'm proud to be a part of the movement that we have quality education available for clinical education, where we give actual hands-on and you learn how to do what we're talking about.
Absolutely.
Yeah, so that's what it is, yeah.
Well, and like you mentioned, I mean, all the changes are going on in dentistry, and I'm always very impressed, I think, with people like yourself who continue to push the envelope in regards to making sure that you're educating people out there. And certainly I know you're driven by the industry continuing to grow and move forward and raise that integrity. So super cool.
Well, it is. It's very exciting. And what happens, though, is that we have to all look at each other and make the dedicated decision that we've got to make the changes that are necessary to meet the demands of what we're being held accountable for with the oral systemic crossover. And how do we have that conversation with our patients and discuss their diabetes or their heart disease or their pregnancy, and then end up treating them the same way we've been treating them for all these years. So we've got to make the changes that are huge leaps in our own education so that we can meet those demands of accountability. So it's very exciting, but at the same time we have to get back to our commitment to our profession and our licensure, because it does demand that we take care of the patients and the public, and that's what we should be first thinking about at all times. So I'm happy to be here. My course that I'm going to be giving, I'm giving 2 hours tomorrow, 2 different hours, and it really is about the new classifications from the American Academy of Periodontology. I'm really proud to say that I've been attending that conference for over 40 years. And when I had attended for 25 years, someone made a comment that there was a hygienist that had been coming for 25 years. And I nudged the person next to me and said, wow, that's amazing. And then they said my name. I was like so surprised. Time flies, you know. But I say that for one reason, because I think it gives me the privilege to be an educator, because I can connect the dots to what's happening in periodontics scientifically to how we need to implement and treat our patients. And so my program is about the new classification systems that were literally just published within the last couple months. And so I'm going to bring everybody up to date about gingivitis. It's not what we thought it was, and in fact it is the beginning stage of all of it through the inflammatory cascade. So understanding that and getting a foothold in recognizing why the American Dental Association gave us new codification specific to gingivitis, all these parts come together now that we have these new classification systems. But the new systems are really based more on what oncology has been doing in grading and staging our patients based on diagnosis. So it gives us a clearer picture as to the outcome to treatment and considers what it's going to actually take to get the patient healthy, and then the staging of not only periodontitis but gingivitis, where our patients can be having had periodontitis and they become healthy because of the care that we give them. We stop the infection process, and now where do we classify them? They become a gingivitis patient if the infection comes back. So these are all new conversations that we're going to be having, and I hope to bring to light a lot of that tomorrow in this opportunity with this wonderful group that's here with all these people that are really dedicated and focused on the oral systemic link and the wellness model in their practices.
Yeah, absolutely. So you and I were talking before the podcast, something very interesting, which is there has been a lot of excitement around the oral systemic link in dentistry simply because I know a lot of dental professionals that I spoke with, it's one of those things like, wow, like people are starting to realize the connection. And we've been trying to share that connection for so many years, which is great. But like you and I said, that's part one. Part two is the hard stuff. Part two is the implementation. Part two is where we're, need to put together these implementation programs in order to be able to really help the patients with their health. And I think a lot of what you're doing is getting a good start on that.
Well, it is, and it does come down to implementation, not only through the conversation, because the public is becoming very aware, and through their medical risk management with their physicians and the aging population when we get into the boomer generation. And yet statistically, we know that the patients in the boomer generation, 70% of them are undiagnosed and untreated in our practices. So where are we falling short of that with ReCare? So it really is helpful that we have these new classification systems, and I hope that my colleagues and my contemporaries recognize that this is where we have to focus our attention in making those changes. The classifications support the oral systemic link and opens the conversation immediately up to the patient for accepting treatment. But how can we treat our patients if we don't learn new clinical methods of treatment? Right. And I think that even the AAP is addressing this with the classification system, saying that it really does bring in new diagnostic models using oral DNA, things like this, and assessment of risk, and using new models of care that require education. So we're all on the same page with that, or hopefully.
Talk about the role of today's hygienist in this exact process. It's changing a lot and really needs to change.
Well, the accountability is what has changed, and if the hygienists aren't aware of this, or the dentists, the American Dental Hygiene Association, in collaboration with the American Dental Association, created a white paper in 2016 that clarifies the dental hygiene diagnosis process, which really cuts to the chase with the communication between the dentist and the hygienist. That instead of discussing the minutia of the patient's our evaluation with the patient, when the dentist walks in for the evaluation to be discussed, just jumping right in and classifying the patient for the doctor allows the dentist to make more comprehensive decisions about the care or the actual diagnosis. So dental hygiene diagnosis is a new place for all of us hygienists, and we have to have the confidence, and that's based on education, once again, to be able to enlighten our patients, spend the time. If a patient is healthy, we don't really need to spend a lot of time with them clinically, but our population base is unhealthy. The prevalence of periodontal infection is 86 to 87%. So if the patient base is unhealthy, our time needs to be spent on risk assessment, evaluating where their health is, and then making comprehensive decisions based on the new classifications, and then scheduling our patients for additional treatment that will get them healthy and keep them healthy. So it's exciting.
No, absolutely. And looking back in some of the work I've done, it still amazes me. The one thing that I think we all knew in dentistry when we were growing up was the fact that we always got told, go twice a year, get your teeth cleaned, right? And that became something that was like always in our head.
Yes.
As you have shared, and as I think the statistics are proving, that there is a very small percentage of our patient population that actually do go twice a year. And it sounds like, Janet, that little decision could be the beginnings of a lot of what we're seeing in regards to this. And getting back to basics in a lot of cases and trying to figure that out.
Right, I think, but giving our patients, because we're living longer today, and it's really predicated on how healthy you stay. And yet it's not about extremes of being healthy. It's really about recognizing that inflammation starts in the mouth. And all of the other organ systems are affected. And so if we can do our role, play our role in dentistry to seriously affect the oral health of the patient and stop the inflammatory cascade that's brought on by the presence of a biologic or bacteriologic infection with biofilm. So it's not that difficult, but it's a restructuring of how we interrelate with our patients and with each other in the practice. And yet, science is moving very quickly, creating new models of care, new instrumentation. So this is where we have to embrace all the different levels of what it's going to take and not be challenged by it, but be excited about the opportunity, because dentistry is well educated. And we need to profess this to the public by taking on this new role with the oral systemic and the wellness practice model.
Absolutely. You mentioned something a little earlier that really struck me, and that was that the acceptance of science is not static.
Right.
It really is dynamic.
It is dynamic.
And I was really taken back by that comment, because I think, and you mentioned it, you can, a lot of hygienists and out there, when they really think about a patient coming in and maybe having to share with that patient something that they didn't share with them before, and being concerned about that.
Right.
And being okay with that, and being able to accept the fact that science is always changing and evolving, and share with everybody the statement that you made that I thought was really, really relevant.
Well, I do a lot of speaking and lecturing. I do a lot of programs. My company sponsors a lot of programs throughout the country. And I have a slide that everybody knows me by, and that slide is the very first slide of my program. It says, Mrs. Press, since we saw you last, there's been a lot of changes in dentistry. And right there, that gets the monkey off our back, because it's science, it's dentistry that's changing. It's not that I didn't do my job last time I saw you. It's we have new information. Since we saw you last, dentistry has new information. We now know that infection in the mouth can affect all other parts of the body.
Right.
If you have an infection in your mouth, bleeding gum tissue, I'm going to sit you back up and talk to you about that and what we have that might help affect that and stop the bleeding from your gum tissue. So we've got to remember that science is where we find all of our answers, and our patients come to us because we are the experts. And dentistry is extremely humble, and I respect that. But maybe to a fault, that we need to remember that the public walks through the door on their own voluntary volition. They come to see us because they've made an executive decision to seek our information. So we have to remember that they walk through that door for specific reasons, and that's to get our expert opinions. That's not arrogant. What that is a respect for the profession, and that it is science-based, and they want us to tell them what we know, and what we know and how it's going to affect them, and then let the patients make the decisions.
Sure.
And let's just guide them down that path. So let's be confident that even though this is new information, if the patients come to us and their health histories are complicated, as dental hygienists, dental assistants, office administrators, even the doctors, we don't have to know the answers to all of their medical questions. All we have to do is say, you know what, those are really great questions. We're going to get with your physician, and we're going to bridge the gap and have those conversations so that we can all collaborate on getting you healthy and keeping you healthy. So we need not be concerned about what we don't know. What we want to be concerned about is that we're opening the door to discovery.
Absolutely.
Yeah.
And I think as a patient, I think we're all patients, right? I think patients, to your point, they appreciate that. I think anytime somebody, I think sometimes I try to think outside of dentistry. I think that other people that I work with in a job that I don't know anything about, I'll use a contractor, for example, and they know a house inside and out, or an electrician, and many times the valuable ones are the ones that come to us and say, look, this is what we discovered.
Right.
I know this is not the best news. I know this is not what you wanted to hear, but that's what you're paying me to do.
Exactly.
And I always appreciate that as a customer when someone says that. I still am going to make the decision.
Right.
Am I going to decide to do this or do that? And I think you bring up a valid point. And I remember working with a provider years ago. It was probably the way that she was a dentist, and the way that she communicated with her patients was amazing. She made a pact that said, it is my duty as a dentist to always let you know what I see. You may decide what you want to do,
Right.
but I don't want you to walk out of this practice and
Right.
know that maybe if I saw something that I couldn't have at least informed you.
Exactly.
It was amazing the amount of treatment that she got done because the patients respected that.
That's very true. And, it really is important that we remember that every single time we see a patient. It's almost like we have to rebrand ourselves in our minds and let the patients know that the information that we have is based on their health rather than based on their habits.
Sure.
And dentistry has pretty much always ascribed to a prevention model that our role in seeing our patients was more about advising them that what they were doing might not be working for them. Instead, we should be thinking about their health history, what their risks are, and then treatment, and then how to manage them healthy with prevention. So prevention doesn't start in the beginning. What we should be doing is making analytic decisions, making risk decisions with our patients, treating them medically, dentally, and then putting them into a prevention program once we get them healthy. So that's our new role, and it's exciting, and medicine is right there with us.
Yeah, no question. Some fun questions for you? Are you game?
Yeah, sure,
Okay,
why
good.
not? Absolutely. I'm from Las Vegas. What are you talking
Right,
about?
exactly.
Everything's a gamble, right?
That's right, yeah. So how about your favorite time of the day?
My favorite time of the day?
Yes.
Actually, my favorite time of the day is in the morning. I'm a morning person. I love the morning. I love to see the sun come up. I love to see the sky. And I live in the Southwest, so it's really pretty with the shadows and everything. So I like that. So that's my favorite time of the day.
Okay.
I get a little tired in the afternoon, so I'm kind of a napper.
Yeah, I love it. How about favorite day of the week?
Favorite day of the week? You know what? I really love Monday. Because Monday, you're always fresh because you've had a great weekend, or at least you've tried to. You've had, you've probably had friends around, or you've done things that you like to do outside of work. And so by Monday, I'm ready to get back to work.
Yeah.
Yeah.
All right, so since we are in Vegas and you have been here for many years, let's get a Vegas stat. So you shared with us on the break, what was the population and what was it that you were sharing with us,
Yeah.
and what is it now?
Oh my
and the
gosh.
growth that you've
Yeah.
seen, which is
Well,
amazing.
my family moved to Las Vegas in 1960. The population was around 138,000 people. There were dirt roads here, and the tumbleweeds were as big as the house, right? And it was hot, let me tell you. And now fast forward to 2018, and our statistics say that we're up to 2.5 million people. I mean, I think, where are they? It's like it took forever for me to get here
Yeah.
from the other side of town today, and I only live 10 miles from
Yeah.
this hotel. So it's a big growth, but it's exciting because we're an electric city. Everybody in the world knows Las Vegas. Everybody wants to come here. So my mayor would be happy that I say, come on down to Vegas, okay? So we've got all the new professional sports coming,
Yeah.
and it's been a huge growth for our city. To bring all that in, and we're excited about all the changes. But if you haven't been here, you need to come. And if you've been here, it's time to come back, because every time you come, it's new stuff.
I love it.
Okay.
I love it. So last question, and you may get the opportunity to do this, but if given the opportunity to speak with some newer hygienists that are getting ready to start their journey in dentistry, with what you've learned and with what you know, and again, you've been such an advocate for education and still are, what would you share with them? What would be a couple things that you would want them to leave your class with in regards to having a successful career?
Right. I think that the new hygienists and dentists and all the team members, what they need to realize is this is the best time ever in the history of dentistry. But there's a lot of accountability that comes with that. And yet we've been educated and trained. We have the intelligence to take this on, but we have to really commit to the process of education and constantly be looking out on the horizon for what's the next new thing to be doing as we evolve our patients' care. So it's the best time ever. It's a career that's going to last them for a lot of years. And this is only the beginning of this oral systemic relationship. So congratulations. Welcome. It's a great time.
Awesome. What a great message.
Okay.
And thank you so much for coming on. I really
Thank
appreciate it.
you.
Really excited to get some feedback on your course tomorrow. I know there's going to be a lot of great nuggets in there for people that are here. And best of luck to you as you keep doing great things.
Well, I appreciate that, and I do want to do a shout out to Christine and thank her for her vision, because this is, I think, her first production program with all of these people involved in the oral systemic and insurance and all of the classifications and everything else. So good job, Christine, and we're glad we have you as one of our mentors.
Absolutely. Yeah. I mean, as you know, you've been to events many, many years in your career, and to do something like this is
Yeah.
certainly no small task.
No,
and,
not at all.
Especially in today's day and age. And so we're excited to see where this goes.
Yeah, collaborative thinking. It's very good. So thank you so much, John.
You got it. Thanks, Janet.
Bye-bye.
Bye-bye.